Lung cancer remains one of the most common and deadliest cancers worldwide, including the United States, where it leads cancer-related fatalities. The American Cancer Society and other health organizations continues to emphasize the importance of early detection in improving survival rates. Lung cancer often develops silently, but understanding its early signs can make a life-saving difference. Here, we explore the symptoms, risk factors, and what to do if you suspect lung cancer. A persistent cough that won't go away. One of the most common early symptoms of lung cancer is a cough that lingers for weeks or even months. While a typical cough from a cold or respiratory infection usually subsides after a short period, lung cancer-related coughing tends to persist, often worsening over time. This can be especially alarming when a cough that starts as dry and mild becomes more severe, producing mucus or blood. Smokers or former smokers may dismiss this sign as smoker's cough, but any new or changed cough warrants immediate medical attention. Importantly, while coughing is a symptom of many less serious conditions, its persistence is a red flag that should not be ignored. Early detection allows for more treatment options and better outcomes, so addressing this symptom with urgency could make a huge difference. Coughing up blood. Medically known as hemoptysis, coughing up blood is one of the more alarming signs of lung cancer. The blood may appear bright red, rust-colored, or in streaks mixed with mucus, and while this may seem frightening, it can be a key indicator of lung cancer that shouldn't be overlooked. Even small amounts of blood, whether bright red or rust-colored, can signal significant damage to lung tissues. The presence of blood indicates that the cancer is affecting the airways, leading to bleeding. It is crucial to contact a healthcare provider right away if you experience this symptom. Often, hemoptysis is one of the signs that prompts individuals to seek medical care, leading to an earlier diagnosis. In many cases, the earlier lung cancer is diagnosed after this symptom presents, the better the chances of effective treatment and survival. Shortness of breath. As lung tumors grow and interfere with your airways, you may experience difficulty breathing, even during routine activities. This could manifest as a subtle tightness in the chest, or more severely, as full-fledged shortness of breath. You may notice that tasks you once performed easily, such as walking upstairs or carrying groceries, suddenly leave you feeling winded. In some cases, patients report a wheezing sound when breathing, which can sometimes be confused with asthma or other respiratory conditions. If you notice an increase in breathlessness, especially without exertion, it's critical to consult a doctor immediately. This symptom can be a sign that the cancer is obstructing the lung's ability to function properly, and addressing it early could lead to a more favorable outcome. Often, imaging tests such as a CT scan are used to investigate the cause of these symptoms. Chest pain that worsens over time. Lung cancer can cause persistent chest pain, especially when it spreads to nearby tissues or the chest wall. This pain is often described as sharp or stabbing and can be exacerbated by deep breaths, coughing, or even laughing. For many, this pain is mistaken for muscular or skeletal issues, delaying diagnosis. It's crucial to note that chest pain associated with lung cancer can radiate to the shoulders, back, or even arms, further complicating the identification of its cause. While chest pain has many causes, if it persists and worsens over time, particularly when coupled with other symptoms, it's essential to get checked for lung cancer. Imaging tests, such as X-rays or CT scans, can help detect abnormalities in the lungs that may be causing this discomfort. Early detection in such cases can significantly affect treatment outcomes and survival rates. Unexplained weight loss and fatigue. Unintentional weight loss and overwhelming fatigue are common cancer-related symptoms, and lung cancer is no exception. If you find yourself losing weight without changes to your diet or exercise habits, or if you're constantly feeling exhausted, even after a full night's sleep, these could be signs that cancer is affecting your metabolism. Weight loss can occur as cancer cells consume energy from the body, leading to rapid and unexplained changes in your physique. Fatigue, on the other hand, results from the body's increased efforts to fight the disease, often leaving patients feeling drained. Though many conditions can cause these symptoms, they should never be ignored, especially in high-risk individuals. Repeated respiratory infections. Frequent bouts of pneumonia or bronchitis, especially in smokers or people with a history of smoking, can be an early warning sign of lung cancer. Lung tumors can block airways, leading to infections that are difficult to clear up. Often, these respiratory infections seem to resolve with treatment, only to reappear shortly after, creating a cycle of recurring illness. If you're experiencing multiple infections within a short time, it's worth discussing lung cancer screenings with your healthcare provider. Chronic infections could indicate that a tumor is blocking part of the airway, making it easier for bacteria to accumulate and cause infection. Regular respiratory infections that don't fully respond to treatment should always raise concerns about a deeper, underlying issue, such as cancer. Screening tests, including chest X-rays and CT scans, can help identify the root cause. Hoarseness or wheezing. Changes in your voice, such as hoarseness, or a persistent wheezing sound when breathing, can also be early indicators of lung cancer. These symptoms may arise when tumors press against the vocal cords or other parts of the respiratory system. Hoarseness may start subtly, with your voice sounding raspier than usual, and can become more pronounced over time. Wheezing, on the other hand, is often a sign that the airways are narrowing, which can happen due to tumor growth in or around the lungs. Although many benign conditions can cause these changes, such as colds or respiratory infections, prolonged hoarseness or wheezing should be evaluated for potential cancer. Addressing these symptoms early may lead to earlier detection of lung cancer, increasing the chances of successful treatment and recovery. Swelling in the face or neck. A lesser-known symptom of lung cancer is swelling in the face or neck due to a condition called superior vena cava syndrome. This occurs when a lung tumor presses against the superior vena cava, a major vein that carries blood from the upper body back to the heart. As the tumor grows, it can restrict blood flow, causing blood to pool in the veins of the face, neck, and upper chest. Symptoms include swelling, often with a bluish tint, and can extend to the arms and upper chest. In more severe cases, patients may experience headaches, dizziness, and even fainting. While superior vena cava syndrome can develop gradually, it can also become life-threatening, requiring immediate medical intervention. Although this syndrome is relatively rare, it's crucial to recognize its symptoms, as early detection and treatment can prevent more serious complications. That's all for today's video. If you found this video helpful and informative, don't forget to give it a thumbs up and share it with your friends and family. If you're new here, make sure to hit that subscribe button and turn on the notification bell so you never miss out on our latest health tips and updates. Stay informed, stay healthy, and we'll see you in the next video.